Hello everyone, and welcome to Depression in the Elderly, video log presentation number 1, Tips on Therapeutic Communication During the Depression Screen. My name is Contessa Sims, and I'm delighted to be your host for today's presentation. Today, I'll share with you 5 tips on therapeutic communication that you can use during the depression screen. The goals and objectives during the depression screen are to display an attitude of caring, express empathy, make the member feel comfortable enough to disclose how they truly feel, and to gather enough information to make a referral if indicated. When depressive symptomology in the elderly goes unrecognized or untreated, the elderly are at high risk to commit suicide. According to the National Institute of Health, 70% of those elderly who committed suicide saw their medical provider 30 days before doing so. And another 40% of those elderly who committed suicide saw their medical provider within 7 days of doing so. And sadly, 20% of those elderly who committed suicide saw their medical provider the very same day they decided to commit suicide. These startling statistics indicate the need for clinicians to be more proactive during the depression screen. The advantages of screening for depression in the home are that the clinician gets to spend more time with the member. This allows the member to develop a rapport with the clinician and for the clinician to elicit enough information to make a clinical decision. The depression screen actually begins at the very beginning of the visit with the member and way before we get to the actual PHQ-8 questionnaire. This is because from the moment we walk in the door and we speak with the member for the first time, we are using our observational skills to not only assess for depression, but other conditions as well. Tip number 1 of therapeutic communication that you could use during the depression screen is to maintain eye-to-eye contact as much as possible. This allows the member to know that you are giving them your undivided attention. It also shows that you care about what he or she has to say. Tip number 2 is active listening. Try to be as mentally present during the depression screen as possible. Sometimes it's what the patient says or doesn't say that we have to pay close attention to. You can also repeat back what the member says to you in efforts to clarify what they're actually trying to say. Tip number 3 is to pay attention to the tone and rate of your speech. You may need to adjust for any cognitive or audio-visual barriers that the elderly patient may have. Many elderly members are hard of hearing, and they do not always wear their hearing aids. So you may need to speak up a little louder. The member may be slow to process what's being said, so you may need to speak slowly. And finally, you may need to repeat the question or ask the question in another way in order for the patient to understand. Tip number 4 is therapeutic touch. It provides comfort, and only when appropriate. If the member becomes tearful, you may need to stop the line of questioning in order to give them the time they need to express themselves. It may also be appropriate at times to hold their hand and just provide another level of comfort for them. And sometimes the member may even ask you to give them a hug. Tip number 5 is having good body language. Body language is a nonverbal cue to the member. Good body language shows that you care. If it's possible, sit directly across from the patient in a non-threatening way. Maintain eye-to-eye contact. Show respect and avoid doing other things while the member is sharing emotionally sensitive information, such as if they lost a loved one or if they're facing a terminal illness. So in review, the 5 tips of therapeutic communication that will help you during the depression assessment are: number 1, maintain eye-to-eye contact as much as possible. 2, exercise active listening skills. Be mentally present. If you need to, clarify what the patient said to you by repeating back. Pay attention to the tone and rate of your speech. Adjust for any cognitive or audiovisual barriers. Number 4, use therapeutic touch. Provide comfort to the patient, especially if they become tearful. Offer to hold their hand if it's appropriate. And the patient may even ask you for a hug. And finally, number 5, make good use of body language. Maintain eye-to-eye contact, be respectful, and avoid doing other things when the member is sharing emotionally sensitive information. This concludes our 5 tips of therapeutic communication during the depression screen for video log presentation number 1. Stay tuned for video log presentation number 2, where I'll share with you clues to observe for during the depression screen. More specifically, I'll share with you what the physical environment can tell you about the mental health status, and also the impact of depression on physical appearance.